It was my 91st birthday last week. My grandson Tommy, bless his honest little heart, climbed onto my lap, looked me straight in the eyes and said, "Grandpa, why do you always have to go to the bathroom during our games? Don't you want to play with me anymore?" That innocent question hit me like a ton of bricks. There I was, a doctor with over 6 decades of medical experience, being called out by a 7-year-old for something I'd been trying to ignore. The frequent bathroom trips, the uncomfortable pressure, the constant planning of my day around bathroom access. I looked at Tommy and promised him our next game would be uninterrupted. But as he ran off to play, I wondered how many of you watching right now have made similar promises to your grandchildren, your spouse, or even yourself. Promises you couldn't keep because your body wouldn't cooperate. Maybe you've cancelled fishing, trips because there's no bathroom on the boat. Perhaps you've stopped attending church because sitting through the service became unbearable. Or worse, maybe you've started sleeping in a separate bedroom from your wife because getting up 6 times a night was disturbing her sleep. If any of this sounds familiar, I want you to know something important. You're not alone, and what's happening isn't your fault. My name is Dr. William Harrison. I graduated from medical school in 1957, and I'm still practicing medicine today. Not because I need the money. Heaven knows my retirement fund would have been sufficient decades ago, but because after treating over 35,000 men with prostate issues throughout my career, I've discovered something that most modern doctors are either too busy or too influenced by pharmaceutical companies to tell you. In all my years as a urologist, I've never seen men more ashamed, more isolated, or more dismissed by the medical establishment than those suffering from prostate problems. Just last month, a 78-year-old retired firefighter named George came to my office in tears. For 3 years, he'd been told his symptoms were just part of getting older and that he should learn to live with it. George had stopped attending his grandchildren's baseball games. He'd given up on his weekly poker night with friends, and his wife of 52 years told me privately that their intimate life had disappeared entirely. Not because of lack of desire, but because of George's shame and discomfort. Another patient, Robert, a 67-year-old former business executive, told me he'd started wearing dark pants exclusively and carrying extra underwear everywhere he went. The constant dribbling and occasional accidents had made him a prisoner in his own body. And then there's Joseph, an 83-year-old widower, who admitted he'd become so depressed about his condition that he rarely left his apartment anymore. "What's the point?" he asked me. "I can't go anywhere without mapping out every bathroom first." These men, these proud, accomplished men, had been reduced to planning their lives around bathroom access. They'd been made to feel that incontinence, pain, and embarrassment were simply the price of growing older. But here's what nobody has told you. The prostate problems you're experiencing aren't inevitable. They aren't just part of aging. And they certainly aren't something you should silently endure. What's really happening inside your body is both simpler and more complex than most doctors explain. You see, your prostate is a small gland, about the size of a walnut when you're younger. It sits just below your bladder and surrounds your urethra, the tube that carries urine from your bladder out of your body. When you hit your 40s, your prostate begins to grow. This is normal and happens to virtually every man. By 60, about half of all men have what doctors call benign prostatic hyperplasia, or BPH, a fancy way of saying your prostate is enlarged but not cancerous. But here's what they don't explain. As your prostate grows, it puts pressure on your urethra like stepping on a garden hose. This makes it harder to start urinating, reduces your flow to a trickle, and leaves you feeling like you haven't completely emptied your bladder, because often you haven't. That remaining urine becomes a breeding ground for bacteria. Your bladder, which is a muscle, has to work overtime to push urine through the narrowed passage. Over time, this muscle can become thickened, irritated, and overly sensitive, triggering that urgent need to go even when your bladder isn't full. In extreme cases, the bladder can become so damaged, it loses its ability to contract properly. Urine builds up, creating more pressure, more discomfort, and in the worst scenarios, the kind of bladder distension that doctors like me refer to as a burst. Not an actual explosion, but a serious medical emergency where the bladder stops functioning correctly. This isn't just uncomfortable, it's dangerous. Urinary tract infections become common. Kidney damage can develop from the constant backflow of urine, and the psychological toll of constant discomfort and embarrassment can lead to depression, isolation, and a dramatically reduced quality of life. But, and this is crucial, this progression isn't inevitable. In my 6 decades of practice, I've developed a protocol that has helped thousands of men regain control of their prostate health without expensive medications, without invasive procedures, and without the humiliating side effects that come with many conventional treatments. This approach is simple. It's something you can do in the privacy of your own home. It costs very little. And most importantly, many of my patients begin to notice improvements within just 7 days. Before I share this protocol with you, I want to be absolutely clear. What I'm about to tell you isn't some miracle cure or magic bullet. It's based on sound medical science, an understanding of how the male body changes with age, and decades of clinical observation. So, what is this protocol? It's a specific combination of daily habits, strategic nutrition, and targeted physical techniques that work together to reduce prostate inflammation, improve urinary flow, and restore your quality of life. Let me walk you through it step by step. Step 1. The prostatic pressure release technique. This is a simple physical technique that helps relieve pressure on the urethra and temporarily improves urine flow. Here's how to do it. After urinating, when you think you've finished, stay at the toilet for a moment longer. Place the tips of your fingers about an inch behind your scrotum and press gently upward. Hold for 3 seconds, then release. Repeat this 3 times. What you're doing is manually expressing any urine that remains trapped in the urethra due to prostate pressure. Many men are shocked to discover they release additional urine with this technique. For those of you with mobility issues, here's a simple adaptation. Use a rolled-up hand towel placed between your legs while seated on the toilet. Lean forward slightly to create the same gentle pressure. This technique works because it temporarily relieves the mechanical obstruction caused by the enlarged prostate, allowing for more complete bladder emptying. Less residual urine means less irritation, fewer infections, and reduced frequency. I recommend performing this technique every time you urinate for the first 2 weeks, then at least 3 times daily after that. Step 2. The anti-inflammatory hydration protocol. Most men with prostate issues make a critical mistake. They reduce their fluid intake thinking it will help them urinate less frequently. This actually makes the problem worse. Here's what to do instead. Drink 12 ounces of water immediately upon waking before anything else. Throughout the day, drink a total of half your body weight in ounces of water, but stop all fluid intake 3 hours before bedtime. Add 2 tablespoons of unsweetened cranberry juice, not the sweetened cocktail variety, to your water twice daily. Once a day, prepare what I call prostate tea. 1 cup of hot water with a quarter teaspoon of turmeric, a dash of black pepper which activates the turmeric, and if desired, a small amount of honey. Why does this work? Proper hydration dilutes your urine, making it less irritating to an already sensitive bladder and urethra. The compounds in cranberry help prevent bacteria from adhering to the urinary tract walls, and turmeric is one of nature's most powerful anti-inflammatory agents, helping to reduce prostate inflammation naturally. For elderly men who struggle to drink enough water, I suggest keeping a special cup or bottle that holds exactly 8 ounces and marking on a simple chart each time you finish one. Aim for 6 to 8 marks daily, depending on your weight. Step 3. The Prostate Protective Nutrition Plan. What you eat dramatically affects your prostate health. After decades of observation, I've identified specific foods that either calm or inflame the prostate. Here's the simple approach. Every morning, eat 1/4 cup of pumpkin seeds. They can be raw or lightly toasted, but not salted. These seeds are rich in zinc and essential fatty acids that support prostate health. Include at least 1 serving of deeply colored berries daily. Blueberries, blackberries, or dark cherries are ideal. These contain compounds called anthocyanins that reduce inflammation throughout the body, including in the prostate. Consume 3 tablespoons of ground flaxseed daily, sprinkled on food. This provides essential lignans and omega-3 fatty acids that help balance the hormones affecting prostate growth. Dramatically reduce or eliminate these prostate irritants: alcohol, caffeine, artificial sweeteners, and processed foods with preservatives. 4. Elderly men who find eating pumpkin seeds difficult, grind them in a coffee grinder and mix with applesauce or yogurt. For those who have trouble swallowing flaxseed, mix it with a small amount of no-sugar added applesauce. This nutritional approach works because it addresses multiple factors simultaneously. It reduces inflammation, provides essential nutrients for prostate health, and helps balance the hormones that contribute to prostate enlargement. Step 4. The pelvic floor restoration exercise. Many men aren't aware that the pelvic floor muscles play a crucial role in urinary control. These muscles weaken with age, compounding prostate problems. Here's a simple daily exercise to strengthen them. Sit comfortably in a chair with your feet flat on the floor. Imagine you're trying to stop the flow of urine or prevent passing gas. The muscles you squeeze are your pelvic floor muscles. Tighten these muscles, hold for 3 seconds, then relax for 3 seconds. That's 1 repetition. Start with 5 repetitions 3 times daily, gradually working up to 10 repetitions 3 times daily. For elderly men who have trouble identifying these muscles, here's a tip. The next time you're urinating, try to stop the flow midstream. The muscles you use to do this are your pelvic floor muscles. Do this identification exercise only once or twice, as regularly stopping your urine flow can actually cause problems. This exercise works because stronger pelvic floor muscles provide better support for the bladder and can help compensate for some of the urinary symptoms caused by an enlarged prostate. Step 5. The nightly relaxation. Protocol stress and anxiety make prostate symptoms worse. They increase inflammation and cause the smooth muscles around the prostate and bladder to contract, worsening urinary symptoms. Here's a simple evening routine. An hour before bed, turn off all electronic screens. Sit comfortably and place a heating pad or warm towel on your lower abdomen just above the pubic bone for 15 minutes. While doing this, practice deep, slow breathing. Inhale for a count of 4. Hold for 1. Exhale for a count of 6. Repeat for at least 5 minutes. The warmth helps relax the pelvic muscles, while the breathing activates your parasympathetic nervous system, the rest and digest mode that counteracts stress and promotes healing. For elderly men with arthritis or mobility issues who might struggle with a heating pad, an alternative is a warm bath with 2 cups of Epsom salts dissolved in the water. Soak for 15 minutes if possible. Now I know what some of you might be thinking. Can something this simple really make a difference? Let me tell you about a few of my patients who followed this exact protocol. Remember George, the retired firefighter I mentioned earlier? After following this protocol for just 2 weeks, he called my office in tears, but this time they were tears of joy. He'd made it through his grandson's entire baseball game without a single bathroom trip. "Doc," he told me, "I actually watched him hit his first home run. I would have missed that before." Within a month, George reported his nighttime bathroom trips had decreased from 6 to 2. His sleep improved dramatically, and his wife noticed he was smiling again, making jokes, planning activities, returning to the man she'd known before. Prostate problems had taken over his life. Then there's Robert, the former executive who'd been wearing dark pants and carrying extra underwear. After 3 weeks on the protocol, the constant dribbling had stopped. "I went golfing yesterday," he told me during his follow-up visit. 18 holes, and I only needed the bathroom once. Do you know how long it's been since I could do that? But perhaps the most dramatic transformation was in Joseph, the 83-year-old widower who'd become virtually housebound. Joseph was skeptical. At first, at his age, he'd tried many things that promised relief but delivered disappointment. He agreed to try my protocol mostly to humor me, he later admitted. 2 months later, Joseph arrived at my office wearing a bright Hawaiian shirt. "I'm going on a cruise next month," he announced proudly. "First vacation in 5 years. I'm finally living again instead of just existing." Joseph told me he'd reconnected with an old friend, a widow from his church. They'd been having dinner together weekly. "At my age," he said with a wink, "I didn't think I had much life left to live. Turns out I was wrong. These men aren't unusual cases or miraculous recoveries. They represent thousands of patients I've treated over my long career. Men who discovered that prostate problems don't have to define their golden years. Now I want to be very clear about something. This protocol isn't meant to replace proper medical care. If you're experiencing severe prostate symptoms, you should absolutely consult with a doctor. Prostate cancer is a real concern for men our age and needs to be ruled out. What this protocol does is address the most common prostate condition, benign prostatic hyperplasia, in a way that respects your body's natural healing abilities. It works with your body, not against it. And unlike many medications prescribed for prostate problems, this approach doesn't carry the risk of sexual side effects, dizziness, or fatigue that make many men stop taking their prescriptions. As I approach the end of my medical career, I've become increasingly convinced that the simplest approaches are often the most effective, especially when it comes to age-related conditions. The body wants to heal. Sometimes it just needs the right conditions to do so. Try this protocol for 7 days. Just 7 days. See if you notice a difference in how often you need to urinate, in how completely you empty your bladder, in how rested you feel in the morning. After 2 weeks, pay attention to whether you're planning your activities around bathroom access or simply living your life. In a month, notice whether those around you, your spouse, your children, your grandchildren, comment on your improved mood, your increased energy, your return to the activities you once enjoyed. It's never too late to reclaim your quality of life. Never too late to address the prostate problems that have been limiting your world and diminishing your joy. I've seen men in their 90s respond to this protocol. I've witnessed transformations in patients who had suffered for decades. Your age is not an obstacle to improvement. Try it for yourself. What do you have to lose except the bathroom mapping, the interrupted sleep, the cancelled activities, and the silent embarrassment? Your family will notice the difference. But more importantly, so will you. If you found this information helpful, please consider sharing it with other men who might be suffering silently. Like this video, subscribe to our channel for more health information specifically designed for our generation, and leave a comment below if you have questions I can address in future videos. Remember, wisdom comes with age, and so does the courage to address problems rather than simply enduring them. You've earned the right to enjoy these years. Don't let prostate problems take that away from you. Until next time, this is Dr. William Harrison, wishing you the best of health.